Welcome to the Expert Series brought to you by the Lupus Foundation of America. Our health education team is here to bring you experts in lupus to discuss topics to help you live better. Thank you for tuning in today to today's episode. My name is Letty and I'll be your host. I'm very excited to welcome Dr. Olga Kromo, who will be answering your questions about lupus and pain. Dr. Olga Kromo is a board-certified rheumatologist in Miami, trained at the University of Miami Jackson Memorial Hospital, and is fluent in English, Spanish, and Russian. Certified in musculoskeletal sonography, she provides personalized multidisciplinary care for rheumatic diseases, emphasizing communication, thorough evaluation, and the latest treatments, especially for higher risk groups. We are delighted to have you join us today, Dr. Kromo. In this episode, we explore how lupus causes pain, its impact on daily life and mental health, and what newly diagnosed individuals should know about managing it. Our expert, Dr. Kromo, discusses pain, the types of pain, medication and non-medication strategies, the link between pain and fatigue, self-advocacy, and the latest research in lupus pain management. We've got a lot to cover, so let's start with the basics, Dr. Kromo. We know that pain is a common symptom of lupus. Can you explain how lupus causes pain in the body?
Absolutely, I would love to. And thank you for having me here. And it's truly a pleasure to be able to talk with you today. Lupus is a very complicated condition that can cause inflammation of all sorts of tissues in the body, and that inflammation causes the pain. Quite often, it's initially presents with joint pain. It can cause inflammation and swelling in the covering of the lungs and the covering of the heart. A lot of our younger patients present with very debilitating headaches and migraine disorders, and it can affect other organs as well. We can see leg swelling, we can see finger pain, we can see skin lesions that can be very destructive to patients. It's a complicated process that really needs correct attention.
Thank you. What types of pain do people with lupus typically experience?
It's interesting. One of the most probably underdiagnosed, but the most distressing symptom to patients is really bad headaches. There's something that's known as the lupus headache. It can be days and days and days of unremitting headaches, and they can include confusion and memory changes and so on. It's incredibly distressing to younger patients. Joint pain. I think actually quite often joint pain in lupus is not picked up as a lupus condition. Quite often it's kind of chalked up to something else, but this is something that we need to be aware of. Those are the less dangerous symptoms, but very distressing to patients. And then obviously we have other symptoms that are even more concerning, kidney pain, lung pain, heart pain, and other types.
So this pain, the chronic pain that is experienced, how does it affect daily life and mental and emotional health?
I mean, chronic pain is incredibly distressing. It's all consuming. It can prevent a younger or an older individual from being able to function. It's just as it consumes all of your resources. It truly does. It definitely requires attention to alleviate because it is just such a disruptive experience.
And since we probably have some folks that are newly diagnosed with lupus, what do you recommend? What should they know about managing pain?
Quite often, we start with regular anti inflammatory medications like ibuprofen, diclofenac, meloxicam, Tylenol, but they need to understand that these pain medications are not a long term solution. They may provide short term benefits, and we definitely recommend them when patients need them, but they need to understand that this is just a band aid. This is not a long term cure. And if they are experiencing discomfort and pain from lupus, they should seek attention that helps them to prevent that pain.
What are some ways that they can talk to their doctor about their pain?
It's incredibly important to be very clear as to how you describe your pain so that your symptoms are addressed correctly. I strongly encourage all patients to bring with them a sheet of paper where they record their symptoms in advance of the visit. We tend to forget. We tend to forget all symptoms, especially when we're looking at a doctor and trying to remember. So, where is the pain? What has helped the pain? How often do you experience it? Does it come in the evening? Does it come in the morning? What have you tried? What was the benefit or lack of benefit of whatever you tried? All of those features, all of those details will be very valuable to your doctor in trying to help you.
Great. Yes, we absolutely promote the use of a symptom tracker for those medical appointments, precisely because you can't forget, what happened a month ago, 2 weeks ago.
We all do. We all do.
Yes. How effective are medications in treating lupus-related pain?
So, the pain of lupus comes from the inflammation of lupus. And the choices that we have to treat the inflammation of lupus does very, very well when it's attended to correctly. What does that mean? We usually start with something, we give it a medication. We usually start with the gentlest medication, depending on patient symptoms. And then we reassess. We reassess every 4 to 6 to 8 weeks. Hey, is this working? Is this doing what the patient needs? Additionally, if there's true just pain, plain pain medication needed, we do offer those. But again, it's very important to understand that the pain of lupus comes from inflammation, and it's really inflammation that needs to be treated first.
What are maybe some non-medication strategies to help manage that pain?
There's a number of strategies. Stress management is just incredibly important because lupus definitely responds to stress, whether that's hormonal stress or hormonal fluctuations or stress from the patient's job or stress from the patient's accident, God forbid. All of these will eventually trigger a flare, both from hormones and stress, and both of those need to be addressed. So I do discuss with my patients the need to avoid any disruptions in their hormones, including birth control pills, including pregnancy medications. We have a lot of patients that go through a fertility treatment. All of those can potentially cause flares. And I usually encourage those patients to see their physician frequently, sometimes every 2 weeks. Additionally, vitamins can be very supportive. Stretching can be very supportive. Yoga is incredible for patients with lupus. Stress management. Maybe consider what your activities are. Maybe consider taking extra rest, instead of going out. It obviously depends on the patient's life. Our job is to support what it is that you feel is you want to be doing or you need to be doing for your life. So we are here to support you, us, the physicians. But anything that you can do to improve stress management is definitely a benefit.
Is all pain in a lupus patient because of lupus?
No, lupus patients can have regular pains as well. We can have osteoarthritis, so wear and tear of the knees. We can have neck spasm, neck tightness, pinching nerves. Not all pain comes from lupus. That being said, patients with lupus are at extra risk for having other types of pain because they already have so much inflammation in the body that can contribute to it.
And I know fatigue is another common symptom of lupus. We get many inquiries about managing fatigue. Are pain and fatigue connected in people with lupus?
Fatigue can be multifactorial in patients with lupus. Lupus itself can cause fatigue through elevated levels of inflammation. That can be very exhausting to the patient. Not being able to sleep because you have a headache or because you have joint pain or because you have another symptoms of lupus, that can cause fatigue because you're just not resting well. Occasionally we'll run into a patient that has anemia from their lupus, which is just an incredibly, the sensation of anemia is just severe fatigue quite often, including hair loss, including ulcers. So sometimes it's confused with other symptoms of lupus. And then additionally, if you have any kind of mood disorder from lupus, that can also cause fatigue. So multifactorial, all forms of fatigue need to be teased out and understood as to what their cause is and attended correctly.
Thank you. Sometimes we get inquiries, people saying that they feel their doctor's not taking their pain, their complaint of pain seriously. What are some recommendations you would make?
It's very hard to ignore symptoms that are presented in a very clear, very organized way. This is yet another reason I strongly recommend for patients to bring in records, diaries, write things down. Because when you're presenting the doctor with, I had pain several times this week, this is when the pain started, this is what I tried for the pain, this was the result of that attempt to manage the pain, it's very difficult for the physician to not pay attention to that because it's presented in a very comprehensive way. I do strongly encourage that. Additionally, I also strongly encourage our patients to be very precise about the location of their pain. Because if a patient comes in and says, oh, I have back pain occasionally and I can't really tell you where it is, it's very difficult to provide a specific recommendation or medication or treatment for that versus a patient coming in and saying that, hey, I have left knee after 2 hours of use. I've tried topical medications. I've tried ice packs. It's not really helping me. I have pain 3 times a week. So very specific, very organized presentation of when, how, and what you've tried becomes very difficult to not attend to correctly.
Thank you. And lastly, Dr. Kromo, what advances or promising research are happening around lupus and pain management?
I think this is going to be the decade of lupus medication. It's very exciting that we already have three very sophisticated medications that came on the market in the last 10 years or so, and we have a number of new medications in the research pipeline. I do conduct lupus research in my office, so I have access to some of this information early on. A number of really brilliant medications, both oral and IV, obviously for the correct patient, with minimal side effects, if anything. Definitely not the terrible side effects of prednisone that we sometimes see in patients who take them for a very long time. Really good choices. Most of them focus on the inflammation of lupus, which is ultimately the cause of the pain in lupus. So very exciting promise, including vaccines for lupus.
That's wonderful news. That's wonderful news, Dr. Kromo. That the next 10 years, you say.
It's definitely going to be the decade of lupus medication. Absolutely.
Thank you so much, Dr. Kromo, for your time today and helping us understand lupus and pain. I'm certain the information you've shared today will be of tremendous help for people dealing with lupus pain. And for those listening in, you can find more information on lupus from the National Resource Center for Lupus by visiting lupus.org/resources. To listen to additional episodes of the Expert Series, you can visit lupus.org/the Expert Series, where you can subscribe to get alerts when podcasts are released. And if you would like to connect with one of the health education specialists, you can go to lupus.org/health educator or call 1-800. Finally, to connect with others with lupus in a supportive and understanding environment, I invite you to check out our virtual and in-person support groups. You can find out how to connect with the right support group for you at lupus.org/find support near you. Thank you very much for listening. And thank you, Dr. Kromo, for all your time.
It's been a pleasure.